Hello everyone, I'm Dr. Bornali Datta, a pulmonologist and a public health specialist. The discussion today is the critical question about what COVID-19 pandemic taught us about health system strengthening. We have all just recovered from the impact of the pandemic, and we have seen that there were huge fault lines in the entire dealing of the pandemic by our government, by our public health systems, from the standpoint of diagnostics, therapeutics, healthcare infrastructure. We were found lacking. We could not cope with the pandemic vis-a-vis our population and what service we could offer them. Our planning, execution, monitoring, everything was found lacking as well. So what have we learned about strengthening the healthcare system that we live in, that we work in? How can that be made better? There are three crucial actions that the government and public health bodies have to take. First of all, setting up better surveillance for the disease. Now, surveillance is an ongoing, continual monitoring of the population to find out if there's an outbreak anywhere at all. So we cannot let our guard down. We have to be doing this continuously. Second is the diagnostic and therapeutic strategies and tools that we have, and these have to be made state-of-the-art, best quality that we can offer to our people. Thirdly, investing in healthcare infrastructure and including new technologies and innovations. Now, these are the very important things that we must be aware of. Finally, last and not the least, is our people. We have to invest in healthcare workforce. So we do need to expand our workforce base, because ultimately these are the people who will serve us, who will save us during a pandemic, during any outbreak of infection or disease that takes place. Now, despite the devastating impact of the COVID-19 pandemic on the country and globally, has our government stepped up investing in healthcare? No. We grossly underinvest in healthcare, and it has always been a low priority. And this has to change. The pandemic definitely showed us this. We have to improve the infrastructure we have. We have to improve diagnostic tools that we have, therapeutic strategies that we can use, and we have to use it across the board, all classes, all stratas of society, all areas, be it urban or rural. So this has to be a priority for us. And we are not looking at short-term, short gap arrangements or solutions. We are looking at long-term, sustained solutions that will then help us deal with whatever healthcare crisis, be it a pandemic, be it non-communicable diseases, that may affect us in the future, existing problems, future problems that may come our way. So India should plan for a health task force, which will include national, global experts who will develop a vision for improving the overall healthcare of the population of India. So we have to be done with shortcuts, with short-term, short-gap solutions. We have to stop firefighting. We have to have long-term solutions, sustainable solutions. Only that is the way forward. So I discuss a very pertinent point. India is a global vaccine manufacturer. So we supply vaccines to all the world. However, we still import the raw materials that are required to provide this, to produce vaccines. So this has to change. We have to increase our capacity. We have to put all our resources into capacity building, into strengthening the basic platforms we have for developing newer therapies, vaccines, etc. We need urgent capacity building in key areas of healthcare, ranging from upscaling the manufacturing of active pharmaceutical ingredients and building sustainable ecosystem for raw material production, to new age technology, integrating diagnostic and testing devices into the existing healthcare systems. The time to focus and invest in health is now. If we don't take action now, we will be facing another healthcare crisis in the future, either an existing healthcare problem or a new problem like the pandemic. The time to act is now.